Do you have a colonized or a decolonized mind when it comes to your healthcare? My name is Dr. Steele. I'm a board certified naturopathic doctor. I hold 6 degrees in my field, all in the natural healthcare space. And this month we talk all about colonization and healthcare and how it impacts you. So there is a free webinar. Just go ahead and click the link. It's an instant view and it goes over all of the information, history, background, so you can begin the process of decolonizing your healthcare. All right, so let's get into the understanding of what a colonized mind is versus a decolonized mind, especially as it impacts your healthcare, because you really are very unconscious of it because we've all been born into the system. So let's define it, shall we? A colonized mind largely adheres to beliefs, values, and norms imposed by our colonial powers. So this influence often perpetuates a hierarchical way of thinking where Western practices and perspectives are seen as superior in healthcare. And so this translates in prioritizing Western medical practices above all other practices, even traditional healthcare, and sometimes even nutrition. So oftentimes you'll go into a healthcare professional's office and you'll ask about an herb, a supplement, or a medication, and it's dismissed. A lot of times it's dismissed because of the lack of education and training, but also because it doesn't fit into the current colonized healthcare system. So a decolonized mind, on the other hand, ask these critical questions. So when, let's say we ask a question and we don't get the answer to it that we're seeking, or we get a reaction to it, that's kind of a red flag for us, because we should be able in our healthcare to ask simple questions about our healthcare and about what practices work and doesn't work for us. And we should be able to really bring the value of both approaches to the table, because otherwise we're not really having a fair and comprehensive approach to our healthcare. A decolonized mind, however, in healthcare asks critical questions and even sheds light on different cultural practices. The mindset really seeks to understand and to integrate both traditional as well as non-traditional practices. And so you may ask and come to the table with your cultural practices, and if it is dismissed or if it's rejected or not heard or even weaponized against you, you know that that's not a safe space for you to be in. So we really want to work on a decolonized way of thinking that incorporates cultural sensitivity in all various healthcare practices. I know in my practice alone, I work with people all over the world, and so must respect each and every individual's healthcare practices. So let's recap signs and symptoms of a colonized mind. All right, so first off, a colonized mind is going to be very rigid, it's going to be very restrictive, it's only built off of the trust of conventional medicine, only believes in Western medical practices, dismisses anything that is not part of that colonized system. They're going to have dependency on pharmaceuticals, only prefer medications, be completely reactive with their healthcare, sees pharmaceutical interventions as the only option, the only treatment. So they're going to be very powerless, giving their power away to a healthcare system that really, unfortunately, doesn't care about them. Resistance to anything in the natural realm, that's going to be anything related to holistic medicine, naturopathy, herbal medicine. They're just absolutely, you're going to have all these talking points, oh, you're anti-vax, etc. And then they're going to have a lot of lack of cultural sensitivity, so not understanding the impact, let's say, of, experimentation like Tuskegee, or even with, the early surgical practices on Black women. We're not going to understand why a Black person in general is going to be very afraid to enter the system, especially when these things keep going all the time. So naturally, if you're going to have a decolonized mind, you're really going to think outside of the box. You're going to look at your cultural background. You're going to ask people in your family what they have used, ancestors and that kind of thing. Unfortunately, passing it down from generation to generation has really diminished, especially as we get more into this kind of modernized world. But we can still tap in, definitely with the World of Genetics and the Human Genome Project. That really helped us to gain a lot more insight. And if you have your 23andMe or your Ancestry, they're always updating that information. So definitely keep an eye out on that information so you can have greater clarity on not only just, where you're from and your connection, but also to your health, because that piece of information has really the blueprint to your body. And so, naturally we're not taught that. We're not taught to use data, our own data. We're taught to give our power away, be dependent upon corrupted systems, such as CDC, various different places. And so because of that, we really have put ourselves in a very bad position. And so it is really up to each and every one of us to really expand your mind. I've been studying this, looking at this, because my family was impacted by transgenerational trauma. And so it really became my personal mission to look everywhere all over the world to find answers, to be able to heal some of these very deeply nuanced and complex challenges that really plague us, especially as Black people here in America, but also worldwide. And so if you're interested in learning more about decolonization, I specifically focused on the US system, because that is really kind of a practice model, if you will. And so really wanted to, showcase that. It's an absolutely free webinar. There's a link below. You just click it and it gives you instant access, and you can take a look. And it's all data, all research, all study, nothing, feeling based or really a lot of anecdotal stories in this one. It's just all facts. So if you are interested in learning more about how you can free and expand your mind past what you have been taught that health and healing is, go ahead, like, share, subscribe, and comment for more.